Ladies and gentlemen, I welcome you to today's edition of South Africa. My name is Rogers Turiawe. It's a great pleasure yet again to be here, to come here to have a conversation with people who are doing real impact and meaningful impact in communities. We're going to be talking about a number of issues, and I have gentlemen from a particular organization, a community-based organization that is doing work around, empowerment, that is doing. They're going to be explaining a little bit about it. They're going to talk about all of the things that they do. But also, we want to get a little bit of the foundation where it begins from and to understand, for example, why it began to begin with. And you guys are welcome. So you can always find this conversation on a YouTube channel, Ocssrds Television. Anytime, be sure to bounce back. We're going to be putting it up there. And also to make sure that you get it. You be a part of the conversation. Please make it a point to put their comments. So in future, maybe, when they've done all of the initiatives, we can always draw back, circle back and look at some of those comments so that we address some of those questions that we might have. So, gentlemen, welcome to the show.
Thank you so much.
It's a great stuff that you're doing, at least from what I've read so far, about the Organization for Community Social Support and Research in Development. Such a name.
Yeah, sure.
And so, first, before we get to the organization, you guys say hello to our viewers. Tell them one or two things about yourselves, what you do, how, for example, after that we'll get into how do you come to begin this organization and what informed the beginning of this organization to begin with. So I'll start with you, sir.
Thank you so much. Thank you so much, the viewers of today's edition. Thank you so much for hosting me and my team. My name is Tumwine Moses. I work from Lyantonde. I work from the Organization for Community Social Support and Research Involvement. And you can make it brief as Ocssrds. And I am the Executive Director. We are a very good and a committed team that is aimed at impacting the community. And by profession, my background is social work. And I did my bachelor's from Kampala International University. It gave me all this knowledge on how to impact the community, and more especially to do the evidence-based work that can be seen by local people and also out the world. Then also I have a postgraduate diploma from Uganda Management Institute, Public Admin, and also I did my master's in Management Science from Uganda Management Institute. So this gives me the knowledge on how to impact my communities and my team. We are a very good team that is diverse, from different backgrounds and of different professions and passions that makes us come up with the work that impacts the community in a different way and without discriminating any category of people, from elderly, people with disabilities, children with disabilities, the young, the women, the youth, and all that. Also the politicians, the duty bearers and stakeholders, and also international community. So this gives us hope that all the viewers will get this opportunity to copy from us and also join us for the cause and help the people of Uganda in particular and also the whole world. Once again, thank you so much for hosting us.
Thank you for being a part of the conversation. I feel like I'm with professors here. So tell us a little bit about yourself, sir.
Yes, thank you.
Just say hello to the people and also a little bit.
Hello, everyone. My name is Eric Thokerunga. And I also work with Ocssrds, like my executive director said. Yes, at Ocssrds, I'm in charge of grants, fundraising, and then education and research. My background is in the medical field. I have a master's degree in medical microbiology. Yes, which we have obtained from the prestigious Wuhan University in China. I did my bachelor's degree from Barar University of Science and Technology. That was around 2014 and 15 when I graduated. So when I went for master's and I came back to the Lyantonde district, then I met this very inspiring gentleman called Tumwine Moses. And he briefed me about the activities that he was doing and the passion, the great work that he was doing for the community. And looking at the challenges, especially healthcare challenges that were facing the community, it was more or less a no-brainer to put my talents into action, to make sure that we try to uplift the community in terms of healthcare. But again, knowing that the organization was still a small budding organization that needed funds. So we also had again to put in all our energies, all the skills that we have in fundraising to try and at least make sure that we're able to get some resources that we can use, yes, to push the organization forward. So today I'm really very happy to be here, and I hope we can have a very candid conversation about where we hope to take this Ocssrds forward.
So you understand what I meant by professors. You studied microbiology?
Microbiology, yes.
In China?
Yes, in Wuhan University.
Wuhan, where COVID?
Oh, yes,
yes. Okay, so just to, I think I'll begin with him being the CEO and founder at that. What informed the beginning of this institution to begin with the organization? And why particularly in Lyantonde, why not anywhere else in Uganda?
Well, thank you so much. Once again, I told you about my background, and my first placement for job, I was working with young girls, specifically on how to make pads for them. And I didn't know that even a graduate can go and start making pads. But when time goes by, I started realizing that it is not all that about making pads, but it's about how to make someone's life better. You get? That's number one. Number two, it is also to identify how somebody is going through a lot of challenges, but you have the capacity to actually invent solutions for that. You get? So I did that one in Kampala and Wakiso. Then after I went ahead and worked in a feminist organization in Western Uganda. But I tried to realize that most of the challenges that we have in our communities, actually we have solutions for them. When I tried to do some activities with the beauty bearers of Lyantonde, and I realized that the HIV/AIDS in 1982, it started in Lyantonde. By then it was still in Greater Masaka. Okay. That's why they say that HIV started in Rakai or Masaka. It is in the Lyantonde district. And the fact that it started in the Lyantonde district, people lost hope. And that wave, it took the economically active people, the adults, leaving a number of young people orphans. You get? This causes depression, and all those, if you combine them, they take us to poverty and the trauma and depression that these young girls have. So when they tried to experience that, now these people, they tried to become economically unactive because they realized that we are dying tomorrow. And it was not actually the case. You get? So this one made them not to work.
So why struggle if you're going to die?
Yes. Why do you struggle? So this made them not to work and depend on handouts. You get? So that's why the poverty levels of Lyantonde, it is actually high, and also the HIV prevalence in Lyantonde, it is also high. Then also the economic status of Lyantonde for both young people and old people, it is a bit low. It is a bit low. So there is that gap. You get it? So when we tried to intervene, we realized, number one, we have to embark on now looking out for a young boy and a young girl. Number one, to track their health status through our community health program. I didn't tell you about all the programs that we are having.
We were going to get to that.
Yes. Then we realized that since we are doing this one, we have to now make it formal and then come up with solutions. This became intense now in the COVID-19 when all of us we lost jobs, when these people were not selling anything in markets, when people were not getting food, when now the sexual workers that we have in Lyantonde, they became sexual workers as a result of HIV prevalence. Okay? So now these people were now stagnant. So the theft increased, people were committing suicide, people were dying out of stress, out of depression. We said, now what do we do now? We said, now because in the COVID-19 now there is no food, let us first handle what? The food issue. Then the issue of depression which we are going to handle. We started working with the duty bearers, the councillors, RDCs, the technical leaders at the district level, the church and all of that, all the categories of people. We started engaging them, soliciting for food relief, so now we can give them. So we did that. But we realized that we shouldn't stop that on food. So we went ahead and said, now, let us make it formal, so that the district and government can know that actually we are in existence and we are doing ABCD. So as a result of food, we said that we are going to keep on giving food day and day. It is not sustainable. We said now Now what do we do? Let us embark on now training these people on how to earn a living every day. Because when you go to Lyantonde, by census of UBS statistics of 2014, we have 94,000 people. That was 2014, which means now we have already clocked around 1,500 people. You get it? So we realize now the population is increasing, but the demand for the little resources, it is now shrinking. You get, people are not getting services, are getting food. We say, no, let us teach them how to earn a living. We started teaching them on how to make reusable sanitary pads, how to make shampoo, how to make bar soap, so that all those entrepreneurial skills, they can grow with them. You get? Then also we realize now we are teaching them on how actually to get what to eat. But now they are now struggling with their life. They are getting what to eat, but now these people are not. Their health is lacking. So through him, we now started a program on how we can actually know their health status. You get? But as we are fighting for for how to get money, let us also manage their status. That's how we started identifying people, children living with HIV, children with disabilities living with HIV, and also those who are taking their tablets very well, and those who are not, so that we can bring out solutions. So that's how we also came up with an idea of tracking the health status using our partners. We have clinics that we are partnering with. They gave us free services. So we identified those young girls in schools and out of school, the teenagers. They go and test for free. They get services for, then they get advice. But we also realize that now there are also young people who have HIV, but they fear to go to get their
to test their health status.
To test, and also if they find that they have HIV, they don't want to go and get their medication because of trauma. How would they see me at my age? You get? So we have to look for people who can do actually for them. This one on a monthly basis, they go at the health center, pick for them, and then he gives them, then they take from home. Then we manage other things together. That is how we made it formal, and that's how we made it a breathing organization in 2021.
Okay. That's a whole lot of stuff that you do. I want to come to here. You have a medical background.
Yes.
So in this work that you do, this organization, and I want to look at, because I see there's even word research in your organization name. Yeah. How do you use research to inform, for example, this kind of approach? Or what approaches to employ as you do this kind of work in the community?
It's a very good question. How we use research to generate data that support our work. Yeah, so at Ocssrds, like I told you before, I'm in charge of research, that's right. Yeah, and you know, when you're looking for finding, for example, and when you need to change minds of people, especially opinion leaders,
yes,
the best way you can do that is by using current statistics. Okay? Yeah. So in our docket as the research team, we are engaged in a number of activities that are helping us to gather information and to gather current data that we can use to talk to the district leaders, to talk to our partners. For example, there's an NGO that was in Lyantonde at the time our organization started. It was called Rakai Health Science Project. I think you must have heard about it. Yeah, it was the one in charge of all the the HIV and TB programs. In Lyantonde and the Greater Masakassa region, under PEPFAR. And they had this program of subcontracting small community-based organizations, to support, for example, like my boss was saying, in terms of the youth adhering to medication, the youth getting information on HIV control, and the use of condoms and things like that. Yeah. So how we are able to convince them to show them that we are doing this activity is by getting current data, on the number of young boys and girls who have HIV in the district, how many of them are on medication, how many of them are adhering to medication. Because, there's being on medication, but they're not adhering. And then you get into issues like drug resistance, which then complicates treatment. Yeah, so as a community-based organization, our role was to make sure we supply them with current information and current data on the HIV activities, especially among the youth, because that was our target. Yeah, looking at the youth component of this HIV activity in Lyantonde district. Yeah, so through research, we were able to generate that data that they need, yes, to support our grants writing, and then the interventions that the NGOs that we partner with are giving. And then you're also able to talk to the district leadership, the district health office, the office of the LC5, and able to tell them, look here, guys, much as the NGOs, the bigger NGOs are focusing on the women and the adults, but there's a very critical section of the youth that are going to be the adult of tomorrow.
Youth and children.
Yes, youth and children. And if you don't focus on them, then there's a very big problem. But that can only be got by active research and trying to find out what the problem is on the ground.
That's very true.
Yes.
Okay. Yes. You said in 2021?
Yes.
It's like, what, 2 years now?
Yes.
And you guys are doing all of this?
Yes.
Okay. So one of the problems that we face with, especially with HIV/AIDS, from time immemorial, not just recently, one of the challenges have been stigma and how community perceives those, especially that have HIV/AIDS. Yes. Many diseases, but in particular HIV and AIDS has a certain level of stigma. How do you deal with that? Because as much as you give the medicine and whatnot, do you also do some sort of like counseling? How do you deal with stigma in community itself? But also since you deal with youths and children in schools and stuff like that.
It's a very brilliant question. How we deal with stigma. Yes, so I want to direct your attention to one very beautiful program that the Rakai project brought on board called Dreams.
Dreams.
Yeah, Dreams is under is one of the programs that was basically dealing with the psychosocial support for the young girls and the youth. There was one of these young ladies that we worked with. I will not mention her name for obvious reasons. No. Yeah, and she's 16 years old, got HIV from the parents, and she told us whenever she went to pick medication, looking at her colleagues and people who are healthy passing around, she was so suicidal, almost at the point of committing suicide. So what Dreams brought on board was how can we create an environment where these young ladies, young boys and girls can feel safe, feel secure, and feel not stigmatized. So they employed counselors, that's number one. Then number two, they created youth clinics away from the main hospital. So they created particular points. There's one NGO called Salamichil Foundation that offered their grounds for youth-friendly services. So instead of going to pick medication from the hospital, these young girls and boys would go to Salamichil, where the environment is,
it's favorable, it's comfortable.
Yes, it's very conducive. So they'll go and pick the medication from there. Now, when they come to pick medication, there they get counseling, they get training on how to relate with their colleagues. Yeah, and that's where we also came in with with our component of trying to help and see if we can involve in counseling and psychosocial support.
Support, yes. Okay.
Like that, yes.
I think to add on what he has said, on that we also developed what we call the referral pathways system. We trained what we call community facilitators at sub-county level. These community facilitators, their role is to bridge the gap between the service and the consumer. You get? Yes. So these people, for them, their role is they go in this at household level. Then they train you on the process that you can go through to get the medication. Also, to get help, it may be in form of counseling, it may be in form of testing, it may be in form of anything, but you must be knowing how and where to get the help from. So that referral pathways, it bridges the gap from the DHO, for example, the district community this community,
The local governments.
so those structures, then they bring them to at sub-county level, lower local government, sub-county level. So then after that, they go to village level. So somebody must be aware on which office are they supposed to go to and to get what. You get? So that referral system, it has helped our communities so much, especially on these people who don't know where to get the information from. Because in our areas, most of the people are illiterate.
Yes.
And they don't know how to seek information and from where. So these community facilitators, their duty it is to do that. And that's why our people, they have been helped and they have been actively engaged in our activities. Even if we have a counseling session, even if we have a training, these people must be active. And this is because of all that system, the referral pathway system that we have created in the communities.
Yes, I've taken the thing to another level. Okay, so we are going to, I want to get a perspective on many of the approaches that you use. In your work, I've seen some element of agriculture. I've seen financial literacy. It's a holistic sort of stuff. So I wanted you to talk to us about some of those. For example, under agriculture, what do you do exactly?
Okay. Thank you so much once again. In Organization for Community Social Support and Research Development, we have basically 4 programs. Number 1, it is gender equality and economic justice. That is our number 1.
Economic justice.
Gender equality and economic justice. Then number 2 is community health program. Then number 3 is ecosystem and livelihood program. Then number 4 is education and research program. So we basically have 4 programs that we are running, that we designed in a programmatic process to ensure that everything is streamlined. So in this program, we have a number of activities that we have done in all those 4. Let me first talk about the gender equality and economic justice. You get? We have been teaching about equality, feminism, mainstreaming, and all those stuffs. You get? So, but when we are doing that, sometimes we have to go with one side and leave this side and tackle. We have been focusing on women. You get? And without tackling men now. So what does it mean? Is that we are going to have a number of women who are empowered. Then these women who are empowered, they are going to now to get married to men who are not what? Empowered.
I thought men are naturally empowered.
No.
Because how we measure that women are not empowered is so that because men are doing better and women are not so.
No. That patriarchal system, yes, we can realize it, but now we say no, since that natural men, they are born empowered, but they are illiterate. You get? Yes, so they don't know what is happening.
They are not alive to the trends.
Yes. So we say that. Meanwhile, as we are trying to teach these women on how to break these patriarchal norms, on how to realize their potential in life, like men, but we also need to make sure that these women, they have not gone above the what?
The men.
The men. You get? That is number 1. Number 2 is that the information that we are supposed to give women, we are also supposed to give equal that information to what? To men. Also, we realize that now in our villages, even in your own village, when you go there, when you ask in your village, in your sub-county, how many women that have land titles, you may hardly get 1.
Yes.
You get? So which means that if I am married to a woman X, you get? If she's my wife. So if I am selling these things, if I am buying, I'm going to put them in my hand title. You get? My names.
She's not.
Yes. So which means if I'm going to sell them, I don't need to consult her. Yes. And by law to say that if you stay with your wife for 7 years, everything, even if that land that you bought 100 years ago, you are supposed to consult your what? Your women. Number 2 is that these women, they always go in the trading center and try by all means to get the money. But when the money reaches home, that is the money.
It's a man's money.
It's a man's money. You get? So that is why we say now we need an economic justice, both in our families and also in the what? and also in the communities.
So economic justice, okay, sorry, a little bit.
Yes.
Economic justice is so that both men and women can...
Yes, there is justice for money.
Okay.
You get?
Please.
And we have done sensitization using the civic education engagements. In the civic education engagements, you call both men and women. Then you teach them on you teach them about the law and how these people should get money, both men and women, and also how they should handle money. And then also how they should track what? Money. The expenditure and the income, all of them. And you explain their roles. And we have done them at the community level using civil education engagements approach. Then that is that program. Then we have been doing sensitization on the radio, on gender, and how people should respect equality. Then also on community health, as he has said, we have done a lot of work, more especially in the school-going children, the sexual workers, the women, and also at the community level, more especially people things to do with HIV, and also water, sanitation, and hygiene. So a lot of sensitization have been done at that level, but we still need to engage more and also bring other partners on board, because we don't do in isolation.
You cannot.
Yes. Then also on ecosystem and livelihood, it is very interesting that we have also engaged the young people, the school-going children, the Rotaractors, and the systems we have. Why we use systems is for sustainability. We teach you how to plant a tree, where to get a tree, and also help you how to raise a tree. You get for the environment. Then we also train the duty bearers on compliance. How do you handle people to comply on the existing laws? You get? And how do you enforce the law for the people to respect it without now attacking, arresting this one, putting this law? You get? So the soft ways on how you should make people comply to preserve the environment. For that, if people have constructed in a swamp, how would you engage? You get? To ensure that these people complies. Maybe they leave it. You get it? Then how would we preserve the what? The environment that we are having. Now, but we have now integrated this one through smart agriculture. You get it? So now, in smart agriculture, here you train the people how to plant crops or trees that are drought resistant. Okay, those trees that don't change the environment so much, like eucalyptus trees. We always advise people not to plant eucalyptus trees in swamps, but you put them in the what? In the mountains. You get it? Then, and also how to plant trees and also getting money. And this one, they are fruit trees. You plant a mango tree, you are preserving the environment, then you are getting also food. You get it? And also you are getting shade.
And some money.
Yeah, you are getting some money. So we are using that kind of approach. Then if it is agriculture, we don't advise you to go in swamps, to go to do this one. So we advise on the improved way of doing what? Of agriculture. By zero grazing, then you plant your silage somewhere and make sure that you have zero grazing, you are preserving the environment, you're also getting milk, you're also getting money. You get? And the SNV is coming on board. We do the discussion on how they can improve our approaches to integrate what they have with our farmers, because for them they have an improved way of doing things. They have been here for 30 years, and for them they have resources to handle. So we are in discussion with them to deal with a farmer on how can a farmer plant very little land, for example 1 acreage, if they have been getting 10 sacks of maize, how they can improve them to 20, but without destroying the environment. So in this way, on how to make our resources that we have around to make the organic manure which is used now in our crops. You get? So the yields are increasing. We are not destroying our land. You get it? And also people are getting the what? They are getting the command. Lastly, on education and research. This material time, I want to thank.
I also wanted first carry.
Yes. I want to thank him, but just one thing. Then he will explain other things. Now we realize that the school-going children, they have to know that even at their tender age, they can get money. You get? That's number one. Number two is that they can know that what certain person in town is doing, they can also do what? So we now started the social enterprise project. What does it entail? Is that we teach these young children in schools. We go to schools and teach them how to make reusable sanitary pads, how to make this shampoo. We buy the materials and give them. So they struggle with making one jerrycan of what? Of shampoo. You get? Quality. Then after making that shampoo, we also struggle. We give them the ways how they can sell it and get money. Even if a child gets 1,000. So we also tell you how to keep it. So we teach a child on how to earn money, how to earn entrepreneurial skills in schools. You get? Alongside other basic things that we teach them. Then after getting a product, so we now teach them where they should put that money. So now we introduced the saving box in the schools.
In the schools?
Yes.
As in, like...
A primary school.
No, what I mean is...
Yes.
Like every... they're called the pupils.
Yeah.
Like every single one of them has their own saving box, or is a collective?
No, there is a collective box.
For like a whole school?
For every class.
Hey.
Now, in every class, they have leadership. They have a chairperson, they have the treasurer, and they have the secretary. Now, in this case, every child has the saving book. So they make money and come up with their money. And this one said, please give me my saving book. And this one records in her book. And he gives you the money. The money put in the box, and the saving book is put somewhere. You get? So a child will grow when he or she knowing how to make money, how to get a product and change it to money, and also where to put that money. You get it? It's a very interesting thing. I think you can add
if you could just add a little bit about education and research. Now, I understand that the work you do has a lot of research. That's true. But is it just about you and how you do research, or even the education, the way you do and interface with the communities, you also teach them research? Like, how does that work?
Okay, thank you very much for that question. Yeah, I think the research component is basically us.
It's on your end.
Yes.
Okay.
How we do research and collect information to inform our advocacy and then the fundraising projects. Yeah, I want to talk about two specifics of research. Number one, we are in the process of currently conducting a study on water quality in schools. Water quality? Yes. Like I was talking before, in terms of the health program, the program under healthcare. So our work has mostly rotated around HIV/AIDS and then sanitation. These are like the two major areas that the healthcare program has been focused on in the past 2 years. So number one, we have been able to write a project on water quality in primary schools. Here we are looking at both the bacteriological safety of the water that the children are taking, and then the physical chemical quality of this water that they're taking. Like they say, there is a lot of cases of diarrhea that is unexplained among the school-going children. And when you are able to provide the child good quality water in school, you are doing a lot of things. Number one, you are improving the academic performance. But number two, you're teaching them a critical component of hygiene that will not only stop in school, but they also go home and and tell their parents and their siblings and the people around them in the community. So right now we are in advanced stages of sampling water qualities, and then doing the analysis in our laboratory that we are at the hospital. And then in the short time we shall be able to produce a report and see what the findings are, and then the interventions that we can put up. Then number two, we are also looking at the knowledge and the attitude and the practices of young school-going girls in relation to HIV and AIDS. So we realized, like I told you before, that the emphasis on adults has been already captured by most of the NGOs in the district.
Yeah.
And now
even the government, I think the focus has largely been on advanced ages.
Yes. And now that's really starting to take on the youths and the children. And you realize it's even worse at this level because most of them never got this illness by themselves.
Yeah.
But from a child, and with a few who happen to go and stray and get it without having the knowledge on how to protect themselves. So we took a focus on young girls in school. That is the beginning. Of course, like I said, you cannot empower a girl so much and leave the boy behind.
You can't.
But there has to be a starting point. And our starting point has been on young girls. What is their knowledge? And what are the practices and what is the attitude towards HIV and AIDS?
So in this work that for the last about 2 years or so that you have operated in particularly Lyantonde districts, would you say that some of those attitudes and practices have changed? Especially, now there's an element of financial literacy, the whole idea of how to earn a living and livelihoods for all of these people, but also for the practice of, in particular, HIV/AIDS. Has there been change in attitudes towards these kinds of diseases, if I might call them, in the communities you've worked on?
That's a very good question. So, like I said before, we right now there are two research projects that are going on. But from the communication and the advocacy work that we've been doing, you're able to see some indicators of change. That is absolutely true. For example, the linkage, the liaison personnel was talking about, the community liaison personnel was talking about, the ones who...
The ones in the pathway.
Yes, the ones who help these young boys and girls with HIV to know where exactly to pick their medication, apart from the main hospital, and tell them on how to adhere to medication, has definitely had an impact, if I can say. Because we see numbers in these dream centers increasing. Like at some point, especially when the country began opening up. Because remember there was a time when there was lockdown and things were very tight. There was no movement and so on. But as lockdown wound up and people began moving freely, so you see now numbers increasing from 10 children, from 10 youths, and see it's going to 20, to 30. So there's definitely a positive trend.
It's progressive.
Yes, if you draw the graph, it is...
the curve is going up.
Yes, it's a positive trend. And the same thing to the water and sanitation projects. Now you're able to see the water sources in schools being maintained, sweeping around. You're able to see that maybe in the long run, you'll be able to tell the rates of diarrheal diseases if they're going down. Because that would be an indicator of, that the interventions that we are putting, are working. But by mere having a glance at what's going on, you're able to see that some changes are taking place.
Okay, that's true. So Moses, I saw something about a choto. What about that?
The Choto program, it is an approach that we designed for in the community. But there are some specific circumstances where a village, for them they have been left behind completely. So what we do to make sure that they get information is that for us we don't go directly to them. So we have the Choto means we bring like a pot, then we put there some what to drink. Okay, we put like what to drink, like in our area we call it bushera, like porridge. Then we gather like 20 people. Okay, and then as we are taking bushera, we are discussing issues of the community and coming up with solutions for them. Then we are documenting. So when you are doing that one, people are free to express themselves. Okay, that's the number one. Number two, you find them in their respective homes. You get?
Yes.
In the respective homes, then you get like 3 households. Then you start discussing issues of that village and the issues of their health. The people will be very free.
Yeah.
You crack jokes even when you have the speaker, you put them and we first dance as we are taking the what? We are taking the bushera, the drink. Yes. At that point, you are the same. Okay. You even put on sandals like them.
You're relatable.
So you are just you are colleagues of that village. So as you are sipping, people are expressing themselves, and also if you find there is issues that you want, then you actually also request them to come up with solutions. So at the end of that bushera, at the end of that drink, so you already know the how those people are being depressed, what are the causes, issues that are affecting their communities, what are the causative factors, and actually also come up with solutions. So it is a program that we design that it is a house level based to get the information. So we realize that it is a very good idea, because even in traditionally people use it to make alcohol in our areas. Then they beat drums, people come and take and they share, and these things are no longer there. But we had to advance it. So we bring a jerrycan of milk, for example, and you bring everybody come with his or her cup. Then we start pouring and drinking, and take then and also doing what? Discussing. But when you do that, we don't take pictures. You get it?
Yeah.
Because ideally, these people, they are not aware that they are expressing their things, that you are actually taking them seriously. You get it? So these are just they are separate problems that
they are private.
They are private. But realistically, these are the things that actually brings results. Yeah. Even if we want to do a follow-up on something, for example, you get it, and how these people are placed. You just organize the Choto discussion. You go with the milk and you start discussing issues affecting the communities. You get it?
So Choto is more like a community problem identification.
Yes, a community problem identification program, as you have said. Yes, but in this Choto program, we don't bring like 100 people, 50 people. No, you bring very, very few people.
The very one in
yes, in that very locality. Then you discuss issues of that locality. Even if you want to bring something at the national level, you bring it jokingly while you're sipping. People will not take it as a serious thing.
Or won't feel like they have to hold the bag.
Yes, no. Because they even don't expect that now they are going to mention a separate and you will come back for them or whatever. Yes. And also we don't bring the duty bearers. So that you are bringing the RDC, you are bringing the DISO, the chairman, LC5, no. No, you just bring the chairperson LC1 as a leader. You get? And also the chairperson LC1 will also participate in the drinking. You get? As we are discussing issues of that locality. Yes. It's a very interesting program.
It is interesting. You have these things that's where you come from. I don't know, there's a name I've forgotten that they call it. That same stuff is.
Yes, it's called Malwa.
Marwa?
In some places they call it Ajono.
Ajono.
Yes, that is in the East, it's called Ajono. In West Nile it's called Malwa.
Hey, Ajono. I remember Ajono. But so when all of this, you seem to have some sort of an overarching reach. There's this health element, there's an economic empowerment element. It's a holistic stuff. How do you manage to run all of these projects at the same time? Like, if, for example, are you like a very big team, or do you work with very many partners that work is distributed? How do you?
No, basically we have a team of only 8 people. But an interesting part of it is that for us, we empower the public to participate. So it is an inclusive participation approach. You get it?
Capacity building.
Yes. So these people that we said, so for us it is a multiplier effect. So what we do and the knowledge you have, when you go and look for a community facilitator, for example, for a certain sub-county, that's how this person will address you. And this person takes the whole information. Now, there are another approach. We use it as, now the community facilitator said that she's the one person. So we had to look for the ways how this information will look down
to the village.
Yes. Then we started working with already established women groups. You get in the village level. So, for example, in our village level, we have VSLOAs. You get at the village level, they are doing their work of saving. But this community facilitator will come and teach them, yes, that look here. Meanwhile, as you are doing the saving, you can also have an aspect of ABCD. So these people, they teach them. And we convince them that you can also go and teach the what? The public. Yeah. So the information comes from the center. The center takes the information to community facilitators at sub-county level. The community facilitators takes information to the women groups.
Village groups.
Village groups. Remember, these village groups, they are members of those villages, they are not migrating. You get it? So if you give them information, if there is any program like a burial ceremony, a football match, a wedding party, if you interest them, the information will flow, it will reach those groups. These group members, they are the ones who are chairpersons of those functions, and they will
the ones who are going to be
disseminating the information. You get it? So the information flows very fast. That is why the team is very small, but the work we are doing is more. And also,
and also like he was saying, especially in the health subsector, there's definitely partnership. Yeah, because healthcare per se has been really handled into details by much bigger NGOs. Yeah, and the perspective that was being left was the actual grassroots level.
Yes.
And that's why we have really tried to market ourselves as the last mile persons, you know, people who can reach the neglected group and can reach them more effectively.
Is it last mile person?
yes. Yes.
Yeah, because now if you're looking at if you're looking at a household level, for example, the bigger NGOs are looking for these community-based organizations that much established at the grassroots level, who are able to reach that very large family. And that's where we have been trying to market ourselves and saying, look here guys, we are here, we live with these people every day. You may know them, but we feel like we know them much more. Yeah, we know them at much more personal level than you. And if you give us the chance to reach them, we're able to reach them more effectively than you. So when somebody says, you know, when you see a reason, a sense in that, then it's much easier to partner with us
to do the rest.
Yes,
work.
Exactly.
Yes. Okay, so we are sort of going to come to a conclusion in a bit, but I want you to I want to understand, because when you look community social support and research and development, in all of the work you do you again, you were talking about duty bearers. Does government support you? Do you work with them in some way, apart from the NGOs that usually do at the national level and regional levels? How do you work with all of these people?
Thank you so much. As I said, that we don't work in isolation, and we believe that we cannot do the work alone. That's number one. Number two is that we believe that the regulator, which is government, has also a role to play in this context. Then we now develop the system of making sure that all the duty bearers are in know. In this context, if an activity is about education, for example, is that we pass through the office of the district education officer to the cow and also to the security. Security, we have always in good terms with them, because we always include the DPC, the DISO, the RDC, the chairperson of C5, and the rest. Why do we do that? Is that we also interest them that meanwhile, as we are doing ABC, we also have a role to play. The government gives you money to implement all these ones. So, and they have not supported us anyway, but we have engaged or also tried to engage them on how they can be part of us, and we implement inclusively. You get? That's number one. Number two, we also believe that if there is a project that we are doing, for example, today, tomorrow this project will not be there. So for the issues of sustainability, we have to include all these stakeholders, right from LC1 level, and also the community, for the ownership, for ownership and sustainability. That's why we have included them, but the government has not come on board. You people, look, here there is the funding, we don't reach here, but since that you have interested yourself in this one, please support. No. We also go ahead and go in and discuss on the district development plan. You get? When you go on the district development plan, there is areas that are not prioritized. There is funding priorities and non-prioritized areas.
Yes.
You get? But when you try to go deeper, these are things that have affected us. They are not given money. You get it?
They are not priorities.
Yes. When you go to Lyantonde district plan, 5 years plan, there is no money for psychosocial support. There is no money for depression. There is no money for trauma. There is no money to teach you on how to look or to make a product, how to market your product, how to change your product into money, and how to use money. The government cannot do that. And the government has not been interested in that. You get it? So that's why we are interested in the government that please come on board. You get it? Meanwhile, as we are looking for other implementing partners on how they can support us to grow in these areas and impact our areas and also this country. The government has not come to now to realize that. You get it? So, but we call upon them now to come on board and support so that we can work collaboratively and change our communities to create an impactful life for our people.
Okay.
Yeah, maybe to just in a minute add a little to what you're saying. Yeah, you realize the local government of late has become much more organized than before, if I should say. Yeah, there is some level of strictness on which NGOs are in the district, what activities are they doing, because the district wants to know exactly what each NGO is doing in the district. I think it's basically to make sure that there is no overlap between these NGOs, and then there's also no overlap between what the government is doing and what the NGOs are doing. Yeah, so it's very hard to work without them knowing what you're doing. So in every activity that you're implementing, the Lion government agency in the district must be in the know.
Okay, so as we wind up, I wanted to ask you, being the last mile people, what do you think about being the last mile in the whole of Uganda? Like in many other districts, just more than Lyantonde. What is your thought about that?
The last mile, it means that we are actually the last people to reach that person who is not reached by the service. You get it? And we believe that us bridging that gap, that we actually the last mile people. For example, we have the neglected groups, for example, people with disabilities. You get it? So if there is any government agency that has now come on board to look for them, we have children with disabilities and also with HIV. The government has not done much to go in those deep villages to look for those categories of people. You get it? The government has not created a program to go and look for people with disabilities to take them in schools. You get it? Because in our areas, originally, we believe that people with disabilities are the caste. You get it? So they are caste and they don't take them to public. You get it? So that we can go down and dig deep on all those components and those categories and bring them to the world and help them and make them integrate and realize their potential. You get it? And this one makes a sense on how we call ourselves as the last mile.
Yes, okay. And just to add on this, I think if you're going to talk about scaling ourselves to cover much more than just Lyantonde, then that will depend on a few factors. So number one could be financing, for example. Right now we are able to cover just a few sub-counties and in Lyantonde. Then how do you make sure that you're able to scale up and reach other districts?
Go to the greater muscle.
Yes, that's number one. But number two, also being a more of a community-based organization also limits our catchment area. Yeah, so unless we convert and say now we are a national NGO,
you could just be community all over the country.
Yeah, so unless we convert into a national NGO with all its implications, then we're able to scale up to other parts of the country.
Okay.
But also a very critical component of it is that being residents of the district, of the area, yeah, we are much more in touch with our people, much better than in any other part of the country. Because if I transfer myself to Buike, for example,
you do not know what happens in Buike.
Exactly.
But I think why the reason I was asking that is it's very important stuff that you guys do, that many communities will benefit from it.
Yeah, true.
So the question was, how do you make sure, for example, this spreads out to very many other communities? We have a lot of people who are living, for example, with HIV/AIDS. They've resigned on life. They decide, you know what, I'm going to die. Why stress now? But there are people who are getting medication who have lived for 50 years with HIV. So those people in other communities are sort of missing out. But anyway, as we conclude, Justin, I want you guys to give your parting shots and a message out there to any particular institution or body or person that you think needs to listen to this information. I'll begin with this.
Thank you, sir. Yeah, so in my conclusion, I'd like to say that Ocssrds is there in Lyantonde district, and whatever we have discussed is part of the work that we are doing, and that we could have done more if there are some critical things that are able to come on board. Number one, we are still seeking partnership. Okay, in all those 4 programs that the director has mentioned, we seek partnership. We seek people who need to reach the lower levels of the community. We are telling them that we are here, and in all those 4 programs, we have developed some level of capacity to be able to deliver your programs. So if you have an activity that you want to do in Lyantonde district or in the Greater Masaka region, and you feel like you need to reach the last person, please contact us. That's number 1. Yeah, number 2, we continue to still seek funding, both from external funding agencies and even from the government, if the funding allows. So we have offered ourselves as young people who are dealing with fellow young people and trying to change their lives. So we are giving our time, we are giving our resources, and we are here available. So please utilize us. Yes,
thank you.
Thank you so much. Once again, I would like to thank the Faraja Africa Foundation for this opportunity, and I want to thank the executive director, because when we approach them, they are very good people, and this amazing team. We are so grateful to have you on board, and I want to thank you people for hosting us, and it has been a very good opportunity. I think it is still the beginning of the start. Yes. We shall be coming here. As my colleague has said, we are doing work. All that, what I am requesting you, Faraja Africa and the whole world, most especially those people who will gain interest to see what we do. Just, you don't have to waste your time. Just come to Lyantonde, then see the work, see the practical work we have done, see what the amazing opportunities we have created for our people in Lyantonde, then you will appreciate it later. For the partners, this is an opportunity for us that we should engage, and we have an inclusive participation and have everybody on board and create impact for our people. Once again, I want to thank you so much.
All right. Thank you, gentlemen. One has degrees and postgraduates, and another is a microbiologist. And thank you guys for making the time, and well done. It's such a commendable work that you guys are doing in the community, and I wish, honestly, that this information or these kind of services would reach us to spread out to the country, because a lot of people would really be good recipients of these kinds of activities. Very interesting. And that is South Africa. We bring to you stories that are making impact in communities, to see that communities moving from one place to another. At the end of the day, the goal is that as we grow, we change, we evolve, and for the better. So we can't remain the same one. These guys are doing very good stuff. And anyone else out there, if you have an initiative that is going on in the community and you'd like to talk to the world about it, here we are, South Africa. That is exactly why we are here, to make sure that we give you that spotlight, we give you that platform, but also be able to partner with you to see that your work is being realized and the community is made better. My name is Roger Stoyabwe, and this is it for today. I'll see you another time.